Welcome everyone to Lipstick and Lipo, your unfiltered guide to plastic surgery. I'm Dr. Ashley Amalfi, a board-certified plastic surgeon in Rochester, New York, and I am joined by my co-host, Dr. Smita Ramanathan, who comes to us from New Jersey, and she's going to introduce our topic today.
Hi everyone, it's so nice to be here with you all. So today we are talking about our namesake, liposuction, but we're going to dive a little bit deeper and talk about the different types of liposuction. So it's one of our most common procedures, right, Ashley? I think every single year, when we look at all of our statistics, it's like number one or number two. So it's very common, but there are just so many different types, whether it's RFA, ultrasound, power-assisted, just traditional liposuction. We hear a lot about tumescent liposuction in the office. So there's lots of different things. So today we're just going to sort of break it all down and give you sort of the important takeaways and what you should be asking sort of when you go in to see your surgeon.
Yeah, I think it's confusing to patients because there's so many different types, and I think patients worry, like, do I need to decide what I need, or is one of them better than the other? Is the downtime better with one for the other? Like, they're always trying to figure it out and find out which one the best. And the reality is there's so many different types, and there are different types for different reasons. And so that's what we're here for. So you guys don't have to stress about what do I need and where do I need it. That's what you're here for. So when you come for the consult, we're going to take a look at you, at your skin, at the quality of the fat and where that fat is on the body. And then we're going to give you our recommendation based on all these different types as to what the best answer really is for you.
Yeah, that's so funny that you say that, because I literally just had a patient the other day who, is sort of friend of a friend of someone who works in my office, who was like, I'm nervous about going in because I don't know what I need. I don't know what to ask for. And I'm like, it's not your job. That is our job to figure out what you need based on what you tell us. So all you need to know or do is to be able to verbalize and communicate what it is that bothers you, and then that's our job to give you options. But yes, I think when choosing liposuction, and the other thing is I always get patients, I think Vaser is sort of the new popular thing these days that everyone's talking about, and you see it all over social media. So I'll have patients come in that are specifically asking for Vaser, and they might not necessarily be a good candidate for it. And so like you said, the most important thing is your examination and where that fat is and what that skin quality is. And that sort of gears us towards one type of liposuction or a combination, which is typically what we do. We typically combine the different types.
Yeah, and so what can happen when you just do standard liposuction really reduces the subcutaneous fat under the skin. So if there's an area when you pinch it, and there's a big space because the area that you're pinching between your fingers is fat, liposuction is going to lessen that amount of fat so that when you pinch it, your fingers are closer together. And so it's really just deflating. And so the concern is always, if we deflate an area, what's the skin going to do on top of that? It's like deflating a balloon or having a pregnancy. Is that skin going to retract, and is that really tight, healthy, thick skin that's very young and has good elastin, and it's going to look nice and smooth after all the fat is gone? Or is that skin going to still be saggy and have maybe an uneven contour? And then is there an alternative or something else that we can add to the liposuction procedure that's going to help achieve a better skin quality on top of that liposuction? Because we don't want skinny people with saggy skin. That's not really accomplishing anything. We want it to be nice and tight and smooth. And so some of these newer modalities are going to do just that. They're going to help with that skin quality on top of the liposuction, which is really going to give you the best result.
Right. And I think the important thing to sort of just say right off the bat is with liposuction alone, yes, we do have flexibility as far as addressing maybe crepey skin or skin that's just not as tight. But when it does come to sort of that loose, extra overhanging skin, we just make that worse if we just do liposuction because we just deflate it. So really, in those patients, liposuction alone isn't necessarily a good option. And that's when we start talking about excisional procedures like a tummy tuck or an arm lift versus just liposuction of the arm. So that's sort of a separate category.
There's so many people who come in wanting liposuction, and they're just not a good candidate for liposuction, and And that's why you come to see us, because you want to know, like, is there something that I can do, to get to my goal? And you just want to be open-minded, because we're going to give you all the options, but sometimes the best procedure is maybe not the one that you thought that you were going to get. But there are some, like some alternatives with liposuction that do make it a little bit more than just that emptying.
Right, exactly. I mean, I think that's so great about the technology that we have now is we do have flexibility to sort of fine tune it for your body and your skin quality. And,
right.
Like you had mentioned, I always tell my patients, liposuction results, they're just not removing the fat and everything shrinks up, right? Like your final results, I always tell them, half of that is what I do in surgery as far as removing the fat, using the right technology to try to get as much of that skin to retract. But the other half is really your genetics and the quality of your skin, right? I mean, if you've had repetitive stretching of your abdomen from pregnancies or other parts from weight gain, weight loss, or you have stretch marks, which is usually a sign that that skin is damaged, your skin is not going to shrink the way that we want to. And that's all something that we talk about during your consultation, because we know right away just by examining your skin what it can do. But so what are some of these technologies, Ashley? Do you have a go-to if you see someone who just needs a little bit more of that sort of skin love?
So the two big ones that I use in my practice, I think, are really similar to you. I use power-assisted liposuction, which just is sort of a vibrating technology that helps to suck out fat more efficiently. And so I use that across the board. I use a power-assisted liposuction for all of my patients. And then when people have like a denser, thicker tissue that I need to get through, especially my male patients, I go to an ultrasonic liposuction like the Vaser that you use. And is that one of your favorites?
Yeah, we were sort of talking about this before, but I've started to use Vaser pretty much in most patients with power assisted. So Vaser it's ultrasound technology. It's the same sort of cannula or similar cannula than you use for regular liposuction, but it sort of emits these ultrasonic wave, and so it helps
it melts.
It breaks up that fat and melts all that fibrous fat, which usually has a lot of like fascial attachments and banding and things like that. So the ultrasound really breaks that up, but I find also it really does retract that skin much better than traditional liposuction, power assisted or suction.
It's really cool. I did 2 gynecomastia cases yesterday using the Vaser, and when you do that ultrasound through the tissue, so male breast tissue is thick, it's dense, and it's really hard to just suck it up with power assisted liposuction alone.
Right.
But it's amazing when you move those ultrasonic waves through the tissue, that when you just touch and feel the tissue, it literally like melts it away. It's just the coolest feeling. So it hasn't even sucked any of it out, but the consistency of that tissue is completely different once you treat it with the ultrasound, and then it allows you to suck up that fat so much more thoroughly than you would have if all that connective and fibrous tissue was just there on its own. So you can feel the difference on our end almost immediately. So it's so cool. So that on a deeper level, it's changing that tissue so much. It's a really powerful tool.
Yeah, no, it's amazing. And so that, typically with Vaser, even Lysonics was just a straight sort of ultrasound liposuction, it's all sort of timed, right? Like that's we sort of can calibrate the energy level and time it based on what area we're treating. And then you go in with your power assisted, and that's really what's going to remove the fat. But like you said, it literally melts that fat. So when you are removing it just really gets to all the different parts a little bit easier, so you can get all of that fat out.
It's super cool. And if people are sore and bruised, but liposuction in general is it's a very sore procedure because it's a pretty rough procedure. It's not delicate. And so you're going to expect a lot of bruising and swelling with all of these technologies. It's not like one is better than the other. One has a quicker recovery than the other. They're all the good thing about liposuction is you're only really limited by as sore as you are, but you can't really mess liposuction up. So for a lot of our patients, I think they get back to normal really quickly, but you're really bruised and swollen and sore underneath your clothes. It's just that everyone in the outside world might not know that, it makes it a really easy procedure to hide. But not, I think they're all kind of tough recovery that way. They're always swollen, they're always bruised, but there's certainly not like one I think that's really better than the other.
Right. And I think, the benefit of liposuction is that you have small incisions. So even though
it's great,
even though you are sore and you literally feel, I always tell people it's like someone just like punched in one spot over and over again. It's just like this, it's like this very
we
sore,
punched you
we
over
punched
and over
you
and over
literally,
again.
quite literally,
with
actually.
a stick.
So you just feel really sore. But you're not limited by these big incisions like you are for a tummy tuck or a breast lift or an arm lift. You have these, few millimeter little incisions kind of spaced throughout. And those heal great, right? But the swelling and the bruising, that's a given no matter what type of liposuction we do. But the results are so great. Once you can sort of like get over that initial few weeks, do you have your patients do lymphatic massages?
I do. I don't send them to someone specifically, but I have them kind of do it at home. And then a lot of my patients will already have a masseuse and then we'll want to see them for a more formal massage.
Yeah.
And I think that's really helpful. I think it helps things be nice and even and helps that edema and swelling go away quickly. And I think it also feels good. Like, I think if you don't touch those areas, they become so sore. And so I think actually touching all those liposuction areas is a very healing thing to do.
Yeah. So, right. I think lymphatic massages help. We always do compression, and that just gives you a little extra support and helps with the swelling.
It feels good too,
feels good.
when those areas aren't like wobbling around. Patients will try to take their compression off and then they'll actually go back to it because it just feels better at the end of the day to wear something a little tight to prevent it from swelling up, especially when people go back to work, which after liposuction is really soon.
Right. It's very
sometimes
soon.
Just a day or two. Yeah.
So I think, when if you're considering liposuction and you're going in for a consultation, like you said, just sort of be open to our, options and suggestions and not be sort of scared about one type of liposuction versus another. At the end of the day, we're going to sort of offer what we think is going to get you the safest, but the most reliable results. So you get, so you reach your goals ultimately, right? But the recovery is sort of the same. And there's, and sort of the good thing, this is sort of why our field I think is so great, is because we do adopt different technologies so easily, compared to other fields. And I think we're just innovative and constantly looking for new things. But there's also, we talked about ultrasound, but there's also RFA technology, which really helps with skin tightening. So I think they're great for those patients that necessarily don't have true overhanging skin, but, they just have a little bit of loose skin, that could go either way, as far as after surgery resulting in loose skin. And so with RFA technology, that sort of focuses on the skin and all those fibrous bands underneath and really helps kind of shrink down that area. So there's Renuvion and Body Tight, and those are sort of the two big ones that we use.
Yeah, there's so much fun stuff in plastic surgery, and it's constantly changing, but you guys don't have to be on top of it because we already are.
Right.
And we're watching, what's FDA approved, and we're looking for safe and reliable results. And if we think something's really great, we're going to offer it to you. But just be open-minded, because what you think you need and what you really need to achieve your goals might not be the same thing. But we're here to educate you and to help you understand and to offer you safe and effective plastic surgery to achieve your goals.
Yeah, absolutely. You know what I think we should do on another episode is talk about recovery after liposuction, because I think there's a lot of nuances with compression and making sure there aren't seams and things. There are zippers,
top of foam, and smoothing things out. That's a fun one.
That's like sort of like a whole episode on its own. But
All right,
But stay
coming to you.
tuned.
Maybe
Coming
next
to
month.
you. Exactly. Well, this is a
Awesome.
great one.
All right, you guys. Thank you for tuning in. Lipstick and Lipo. Make sure to subscribe on YouTube so you catch all our new episodes from your unfiltered guide to plastic surgery. Take care.
Bye, guys.